My name is Ray Beauchamp. I'm the managing partner and president of Radiology Associates of Richmond here in Richmond, Virginia. We've been practicing private practice of radiology here since 1905, and I've been the president since 2012. Dr. Dan Talley, the junior, started practicing radiology here in Richmond in 1905. X-rays weren't discovered until 1895, 10 years before that, by Conrad Röntgen in Austria. So to be involved in the medical application of radiology 10 years later was really on the forefront. The leadership of the practice was then handed off to his son, Dan Talley III, also an entrepreneurial, aggressive type of person who wanted to grow and stay on the forefront of things. And as a result of that, I think it's just been passed on. It's kind of in our DNA. We're always looking for what's the next thing that we can do to provide better care for our patients.
Radiology Associates of Richmond is a neat group of 40-some radiologists that are highly intelligent and very easy to work with. Everybody strives for perfection, and I've really felt honored to be a part of the group. All the radiologists and even other employees are very satisfied in what we do.
We've worked together very well and tried to provide I would say, a very nice and congenial environment. One of the big things that we're well known for is good quality diagnostic radiology and also good quality interventional radiology. Interventional radiology is the branch of radiology that treats diseases. And before the late 80s, there was no such thing. It didn't exist. In the private practice segment of Richmond and Central Virginia area, it did not exist before about 1987, when Radiology Associates, and I guess I was the one that kind of spearheaded that, put together a subsection of interventional radiology. And since then, we've had a group of radiologists that do nothing but interventional procedures.
Now, a lot of what used to be only done by vascular surgeons is done by interventional people, either interventional radiologists or newly trained interventional vascular surgeons who use really our techniques to solve the same problems that used to only be solvable with surgery.
I think the thing that has helped Radiology Associates is the ability to continually change with the times and adapt to new procedures, new techniques, and stay at the forefront of both diagnosing diseases as well as treating diseases.
We have tremendous support with Radiology Associates of Richmond. If there's something that's necessary for best quality patient imaging, then we talk with the board, we talk with the administrators at the hospital and present our case, and typically we get what we need.
Radiology just in general is a lot of fun, and it's collegial. You have a chance to talk to your partners and say, hey, look at this. Sometimes it's just things that only we would really appreciate, but it's nice to have people you can talk to about it. And we're growing, and I think there's a feeling of success and accomplishment, and that's also a strong positive thing for the doctors in the practice.